Hello, my name is Alexis Polly, and this is my pediatric presentation on Hodgkin's disease, also known as Hodgkin's lymphoma. So what is Hodgkin's disease? Hodgkin's disease or Hodgkin's lymphoma is a type of cancer that starts in the lymphatic system. The lymphatic system is part of the immune system, and it helps to fight diseases and infections and that kind of thing to keep people healthy. The lymphatic system also helps balance fluids in different parts of the body. And this is just a picture of a child with enlarged lymph nodes that represents the Hodgkin's lymphoma that this child has. So let's go over the pathophysiology of Hodgkin's lymphoma or Hodgkin's disease. So in Hodgkin's disease, what exactly is happening in the body with this disease is that the malignant B lymphocyte is growing in lymph tissues. It usually is starting in one general area of the lymph nodes. Then over time, the presence of Reed-Sternberg cells, which are giant transformed B lymphocytes with one or two nuclei, they're going to differentiate the Hodgkin's disease from other lymphomas. So as the cells multiply, the lymph nodes enlarge, and this is going to compress nearby structures, destroying normal cells and invading into other tissues. The cause of Hodgkin's disease is still being researched. However, conditions such as the EBV infection, otherwise known as Epstein-Barr virus infection, which is the infection that causes mono, HIV, the virus that causes AIDS, having a family history of Hodgkin's lymphoma, and certain immune system diseases have all been known to be linked to Hodgkin's disease. So like many cancers and diseases, there are different stages with Hodgkin's lymphoma. So you have 4 stages here, and this diagram just kind of represents those stages. You have stage 1, 2, 3, and 4. In stage 1, the disease is kind of localized. There's a single lymph node or region or single organ that's being attacked. In stage 2, there's 2 or more lymph node regions on the same side of the diaphragm. Stage 3, 2 or more lymph nodes regions above and below the diaphragm, and you just have that diaphragm line here. And then stage 4, it's a widespread disease, multiple organs with or without lymph nodes that are involved. In addition to the stage number, the letters A, B, E, or S may be used to further classify the stage of Hodgkin's lymphoma. So here I just have a chart representing what each of those categories involve and what it means. So category A, the patient does not have B symptoms, so it would be a fever, weight loss, or night sweats. Category B, the patient has the B symptoms. Category E, the patient has Hodgkin's lymphoma cells in organs or tissues outside the lymphatic system. Category S, the patient has Hodgkin's lymphoma cells in the spleen. So signs and symptoms of Hodgkin's lymphoma, and they're going to vary patient to patient, so not every patient may have every single sign and symptom, but these signs and symptoms will include or may include painless swelling of the lymph nodes in the neck, underarm, groin, or chest, trouble breathing, coughing, fever for no known reason, night sweats, tiring easily, loss of appetite, weight loss, itching skin, and frequent infections. So how exactly is Hodgkin's disease diagnosed? It may be diagnosed through a physical exam where your doctor checks your lymph nodes, including your neck, underarm, and groin, as well as your spleen or liver. It may be diagnosed through blood tests. So a sample of your blood is going to be examined at a lab to see if anything in your blood indicates the possibilities of cancer. Imaging tests, your doctor may recommend to look for Hodgkin's lymphoma in areas of your body. So this may include x-rays, CTs, or PET scans. Removing a lymph node for testing. So your doctor may perform a biopsy to see if abnormal cells, such as the Reed-Sternberg cells, are found within the lymph node. And then removing a sample of bone marrow for testing. And then a bone marrow biopsy and aspiration procedure involves, inserting into your hip bone to remove a sample of bone marrow. The sample is then analyzed, and it looks for the Hodgkin's lymphoma cells. And this is just a photo representation of what I was saying with the bone marrow needle that is inserted into the bone down to the marrow that would collect the biopsy sample that the doctor needs for the diagnosis of Hodgkin's lymphoma. So this disease may be treated many ways. It could be treated through chemotherapy, radiation therapy, a bone marrow transplant, clinical trials, stem cell transplants, and surgery. Sometimes the doctor may even combine a couple of these different treatments to help with the disease, depending on who the patient is and how far the disease has progressed. Sometimes, though, alternate medications and therapies are needed, such as art therapy, exercise, meditation, music therapy, relaxation exercises, and then spiritual therapies, such as, going to church. Support groups might be necessary here, that kind of thing, just to get the person's emotional and status up and distract them a little bit from what is going on, especially with children. This is a very, very important therapy and alternate route to take with the children. And like everything, complications come with treatment. So associated complications with treatment for Hodgkin's lymphoma, it may vary patient to patient, but it could include things such as increased risk of infection, heart disease, lung problems, increased chances of having other cancers later in life, fertility issues, delayed growth and development, changes in thinking, memory, and learning, increased risk of bleeding, increased risk of infection, nausea and vomiting, diarrhea, poor appetite, sores of the mouth, and hair loss. As a nurse, it is very important that we care for our patients, regardless of their situation, especially with children with this disease. You are going to want to manage the child with Hodgkin's lymphoma by focusing and addressing the adverse effects of chemotherapy or radiation. Also, you want to make a care plan. So making a plan and setting goals with the patient, with the parents, that way they can get through this tough time. Teaching about treatment and side effects of the treatment. The doctor will go over most of the treatments and we'll talk about everything to get the consent. But your job as a nurse, you're going to want to tell them the side effects and what to look for and just kind of reinforce the education that the doctor has given them. Also, referrals to support groups is very, very important. And it's very important just to focus on the child's needs at that time. If it's playing games with the children to get them through and kind of distracting them from what is going on, talking to them, sometimes just talking to somebody can make such a difference. And as I said, it is very important to care for the patient as well as the parents of this patient. So parent teaching, you're going to want to get emotional support for their child. So they might need to find a counselor or child support group that may help not only the child but themselves as well. Make sure that the child attends all follow-up appointments. Your child may have trouble eating, so make sure that they are aware of that and that a dietitian may be able to help with getting all the nutrition that they need in smaller portions and where they consume more of the nutrition they need without having to eat a whole lot. Your child may be very tired, so they'll need a balanced rest and activity. So you want to encourage the child's parents to encourage the child to get some exercise. And this is not only good for the condition, but also their overall health. So this might actually lessen the tiredness if they're more physically active. And this is just a fun chart that I found that I wanted to throw in here. It's myth versus facts with childhood cancer. So you have a survivor of diseases are carriers and pose health risks for others. Cultural beliefs that cancer is related to evil spirits and bewitchment, that is a myth. Actually, childhood cancer isn't contagious. Childhood cancer is not transmitted or a virus or infection. It's safe to interact with survivors. However, with Hodgkin's lymphoma, there is no known cause, but it has been linked to those diseases and conditions that I said earlier, such as the EBV infection or the infection that causes mono, HIV, AIDS, that kind of thing. So if the child has a weakened immune system, they might be more prompt to get Hodgkin's lymphoma. All survivors are genetically inferior and have fertility problems. They can never have children. That is also a myth. This isn't true for most survivors. Types of cancers and treatment determine the fertility challenges. Survivors have shorter lives. That's also a myth. 2 out of 3 childhood cancer survivors have increased risk for late effects and secondary cancers. This isn't linked to the life expectancy. And it also just goes on to say how childhood cancer survivors are cured. Survivors no longer need to continue follow-up care. That is absolutely a myth. You should follow up frequently with your doctor until your doctor says it is okay and they have released you from their care. So you're going to want to follow up and remain within that patient or the doctor's care for many, many years after to make sure that you stay in remission and that it has not came back. Childhood cancer survivors will have a miserable, sad, and dismal future. They can't have a normal life. That is so false. There's normal life and a future after cancer. So most survivors are able to return to school, regular activities, and that kind of thing. Survivors do poorly in school and employment. Also so false. I think it's all in the mindset of the patient. So this is not true for everyone. Some people may do poorly due to depression and emotional status, but if they keep themselves emotionally well, and they want to learn, they want to do better in life, and they want to overcome what is going on with them, they will get there emotionally and mentally, and they will do just fine in school and employment. It's better if children and adolescents with cancer aren't told they have cancer. That is such a myth. You always want to keep up and inform the child and patient about what is going on so they can take charge of their own well-being. Childhood cancer survivors will always carry the stigma of cancer in their adult life. They'll always be discriminated against in society and in marriage and employment. That is such a myth. In most countries, survivors are viewed as heroes and seen as a living proof that childhood cancer can be conquered. In countries where stigma still exists, survivors and supporters need to speak out about change. And that is all I have for you on Hodgkin's disease, otherwise known as Hodgkin's lymphoma. And these are just some of my references. Thank you so much. I hope you learned something.